how the state's mental health department managed to dig itself into a nearly $30 million hole.
The state auditor's office releasing the first part of a report detailing what its investigators found while looking into the agency. News 4's Spencer Humphrey is here with the questionable spending they uncovered. Spencer?
Yeah, guys, and questionable spending, by the way, are the exact words the state auditor's office used to describe this. They say the State Department of Mental Health has found itself where it is because its leaders just simply seem to not understand very basic things about how a budget works. It's only 6 pages, but this preliminary report detailing some of what the state auditor's office found while investigating the Oklahoma Department of Mental Health and Substance Abuse Services packs enough to leave State Auditor Cindy Byrd certain about one thing.
We've got to do better by placing qualified financial people in these agencies to take care of the taxpayers' money.
Its key finding, the state mental health department under Commissioner Ali Friesen's leadership has overspent its budget by nearly $30 million, leading to an obvious question. How in the world?
So a lot of things come into play at the Department of Mental Health.
Byrd says a lot of it goes back to the pandemic, when the federal government temporarily increased how much money it was reimbursing the mental health department for Medicaid expenses. That gave the department a chance to spend that part of its budget on other things. Problem is, when that increased Medicaid reimbursement went away, Byrd's office found the department kept spending as if it hadn't.
There was overspending. Payroll and professional services have skyrocketed over the last few years.
She says in 2024, the department hired 38 people, 21 of them executives, at 6-figure salaries, and also gave hundreds of employees a more than 10% raise. And they kept spending on things like promotional Narcan vending machines and even a pricey Super Bowl TV ad. All the while, Byrd says the department was well aware it didn't have the money.
They knew they were in a deficit. There were no actions taken to curtail spending, and there were no actions taken to bring to the legislators' attention the real budgetary needs of that agency.
Not exactly helping things, Byrd says, was Governor Stitt ordering all state agencies to keep their budgets flat this year.
That may have hampered communication with legislators about the true needs of this agency.
And when her office began investigating, Byrd says mental health department leaders tried intimidating employees into not cooperating, even having them sign non-disclosure agreements. Meanwhile, she says those same leaders were basically MIA, not going to meetings or signing documents. They even hired armed guards to lock down the floor housing their offices. All of it snowballing into a nearly $30 million mess that Byrd says should have been avoided.
This is eerily reminiscent of 2017 with the health department scandal, whenever they thought they were $30 million short. At the heart of that issue was a lack of CFO who really understood the complex financial activities of the agency. Here we are in 2025, and we have another agency without a CFO who really understands the complexities of this agency.
And that report released today is not the final audit report. Byrd says she just wanted to get something out while the legislature was still in session so they can start working on a solution. Now, this all comes one day after Governor Stitt released a report from an auditor he hired to look into the agency. Stitt standing by Mental Health Commissioner Ali Friesen, saying, quote, Commissioner Friesen has navigated this challenge admirably and has kept me and my team informed every step of the way.